All right. Hey, everybody. Welcome to another LinkedIn Live. Um, Here today talking with my friend Erin Duffy of Imagine 360. And, what we're going to talk about today, a lot of times when I bring people on, we've got some real specific, subjects and we've got some real specific solutions that we want to talk about. And in this case, what we really just want to talk about today is the mindset of scarcity versus abundance, and which is it's a very high level, I think, thing today. We're going to talk about a number of things. We'll share a number of examples, and of course, we'll talk about the differences in those mindsets as it relates to change management or transition management, as I like to call it. And anytime that we're faced with challenges inside of our organizations, running our businesses, and just doing our day-to-day operations, we're constantly running into problems. And then, how do you respond to those problems? How is it a response? Is it a reaction? And what is your mindset? What is your attitude as you approach these problems and you try to solve those? So, really looking forward to this conversation today with Erin, who has a lot of experience in working with employers and helping them through that change, helping them through that transition management process. And anyways, just excited to hear from her and have her share her knowledge with the audience here. And anyway, so Erin, if you want to give yourself more of an introduction, feel free to do so, and just give us a little bit of an idea about your background, and also Imagine 360 and kind of where you guys fit into this ecosystem of transition management and abundance thinking for employers.
Yeah, thank you, Chris. I love that. And I'm so excited to be here having this dialogue with you today because it's not one that I get to have all the time with broker partners across the country, because some of them sit in kind of this scarcity mindset and others are in abundance. And you are in abundance, my friend, and I love that. But my name is Erin Duffy. I sit in the Chicagoland area. I have been in the benefits space for over 15 years. And as I've kind of progressed through my career, this is my third employer, I have really kind of focused in on organizations that are continuing to advance towards transparency and have a mindset of abundance. So I've been at Imagine 360 now for 6.5 years, really helping employers and organizations across the country and broker partners kind of visualize what health insurance can be if you have a mindset of abundance. So what do I mean by that? We're a health plan. Imagine 360 is a transparent health plan that puts the control back into the hands of the employers and employees to ensure that both stakeholders are paying what we consider to be fair and reasonable prices for healthcare. Now, to get there, it requires you to recognize that the health insurance world that we live in today is not perfect. And we're not perfect either, by the way. But it's not perfect. And when you only have 3-4 choices for a health insurance carrier, yet the world that we live in has an abundance of choices, that just makes for a tough situation. And so what we do is open up that dialogue, open up that mindset of healthcare doesn't need to be as restrictive. It doesn't need to be as expensive. You employer or you broker just have to be able to think bigger, that there are solutions out there. And do you want to solve this problem? Is the pain great enough? So we're helping companies, Chris, across the country as small as 50 employees have that conversation with what we call a level funded solution. So taking on some of the risk, up to 10,000 plus employees that are all self-funded and in some cases don't even have stop loss coverage, but I think it starts with mindset. So I'm curious to hear, like, what's your path to getting on this train of abundancy and transparency?
Yeah. Well, yeah, good question. And there are a couple things before I answer that that I want to touch on that you said. One was when you talk about this. This abundant mindset. I mean, and I guess to answer your question before I get into unpacking what you just said, I'm just, I guess, this incurable optimist, right? I always kind of see the glass as half full and that type of thing. And for some people that's in your DNA. And I think that the thing that is, I think, frustrated employers for a long time, or I think they've kind of locked themselves into this scarcity mindset because they've been trained partly by the broker community and just from their own lived experience that there's nothing they can do to control healthcare costs, that they have, as you said, 3 to 4 options. None of them are great. You're kind of picking between the least bad and the one that's going to be the least friction or the least noisy from, your employee population as you go through open enrollment. And, it's one of these things that I've heard HR directors tell me in the past. Well, people are going to be upset if we change things. And then on the same token, people are going to be upset if we don't change things. So you're kind of in this rock and a hard place, and you just, it's the analysis paralysis. It's you've got all this information and you've been hearing the same story over and over and over, and that there's nothing you can do to do anything about this. And that's a frustrating place to be, but it's also, it just kind of is like, all right, well, we'll just keep doing what we're doing, I guess. There's nothing else we can do about this. It's, it is what it is, right? And I think that was the thing. So going back, I guess, to my kind of origin story, I guess, in this is, before I had gotten into doing healthcare and health insurance consulting and such, I was working as a financial advisor. And so, I was working with, families to help them set aside money for college, set aside money for retirement, find life insurance, disability insurance. Clients and people that we were working with would come to us. We'd uncover kind of what these problems were, and then we would offer them a solution. And, and there was something that was very satisfying in that. And, I saw enough time pass where some of these families had kids that went off and went to college and used that 529, or, people that eventually did get to a point where they had enough assets where they could retire and not have to work anymore. Or, God forbid, I saw clients that would become disabled or in some cases passed away, and then, help the family members through that claims process. And that was kind of very gratifying in a lot of ways, right? Where it felt like I was bringing solutions, I was solving a problem. And then fast forward to my entrance into health insurance consulting, we were bringing a renewal. A lot of times it was an increase, and then it was like, here's your options. We shop this out to other carriers. We raise deductibles. We raise employee contributions. And then, we hope that maybe the Congress or the government does something different, or the hospital, and it was always kind of these, like, we're like trying to, hope on external factors for better conditions. And it didn't really feel like we were necessarily solving problems. And so that was when that's what really was the catalyst, at least for me, to say, okay, I need to find something else. There needs to be a better way of doing this. This cannot be the rest of my career. I can't keep doing this and feel good about myself and sleep well at night and get up in the morning and be excited about what I'm doing. And so that's when I did start to find not just some of these solution partners that were out there, but I started to find other people that became mentors to me that helped show me that, hey, there are ways that we can that we can reduce costs. There are things that we can do by putting self-containment, cost containment solutions in a self-funded plan. I tried to blend all that together. Anyways, obviously, I get very animated about this, right? But and I don't know if you were expecting as long of an answer as this, but yeah, I think it's worth saying is that, you know, I think the other thing too is that what I've learned through, you know, all of the marketing efforts that we do is really just kind of putting out our message of what we see as the problem, what we see as potential solutions, not necessarily giving anything away, but just saying, hey, look, our strategy here at GBS, our mission, that is to modernize healthcare by building a 21st century health plan that eliminates employee out-of-pocket expenses while guiding them to higher quality care. And the best part is there are bottom line savings for the organizations as well as the employees. Plus, we can take work off of the HR team's plate through our process as well. And again, I think it's a message that I don't know of anybody else who really shares it quite like that. And you know, it's a lot of just kind of, you know, hey, well, we'll hope Congress does something different, or we'll hope this next administration, or we'll, you know, and that's what it was for a long time. And anyways, we, you know, so having that different message and putting that out there, and then attracting those that have reached a point where they're just fed up and are at the point where they're like, look, I've been told this same story every year by, you know, a dozen different brokers now. And, you know, and these people have something different to say, right? That Chris and Erin have something different to say. At this point, maybe we need to sit down with them. We need to find out, you know, what their approach is and maybe how that's different, and see some case studies and start to really dive into this. So, yeah, and really, yes, exactly. And develop a plan, and not just develop a plan for this renewal that you're going through right now, but develop a plan that you can implement and adjust over 3, 5, 7 years, and have something that we're working towards. And kind of, you know, we have to crawl before we walk, before we run, and we can show you the way to do that, right? So anyhow, I didn't mean to turn that into a 10-minute monologue, but
no, I love that. Well, I think you uncovered something though that is, I mean, such a nice translation from what you were doing in financial planning to what you're doing now in helping organizations with their benefits. Is you're helping people plan. And
right.
I think that gets really missed in the health insurance world, especially for maybe smaller to mid-sized businesses that are fully insured and don't have access to their data, and they're receiving their renewal 60 to 90 days before. I mean, this is crazy. So I had 2 calls today, Chris, and they were about groups that one of them, it's a July 1st renewal, and they received a really poor renewal. And I was asked, do you want to take a look at this? And I said, maybe, right? But I think it comes down to the idea of what we're talking about, which is mindset of, okay, well, now it's July 1st. So now we're operating with maybe 60 days to implement this.
Mm-hmm.
The group doesn't know our story. They're so used to probably living in a fully insured world and having this hamster wheel conversation year over year.
Yep.
How do we have this conversation 2 months ago?
Right.
And that's what I think was missing sometimes from the health insurance world, of treating it the way that you treat every other line item within your business, is something that's budgetable, something that you know what you're paying for, and something that you can plan for. But it starts with that plan. And it's got to be 6 to 12 months before the renewal.
Agreed. And I think, and again, just kind of going back to our approach with all of our marketing, I mean, even just this webinar, doing these on a monthly basis, this is a way where I'm trying to essentially engage with the audience, educate them, and, you know, because it is a very, it's a lengthy process to understand exactly how all of these components fit together, and how you can use this to your advantage. And again, just to kind of shift that mindset, because especially if you're an HR person, you've got about 12 different hats that you're wearing, right? You've got a number of things that are already on your plate, and so to educate yourself on a different way of doing this when you've heard the same story for years and years and potentially over decades at this point, depending it's a daunting task, and you're right, you can't do it in 2 months. And the other issue is there too is it's like, I would imagine, I'm not accusing anybody of anything, but I would imagine this group has all they've ever done is, okay, we got a bad renewal. We're 60 days out, right? Let's shop the market where, yeah, could you put together numbers and do an RFP or whatever? Yeah, sure. But that, if they're just simply looking at numbers and trying to pick the lowest number, that's not a strategic decision. That's a transaction, right? That's your, what I do when I'm at the grocery store, I'm looking at, the price per ounce or whatever it is, right? So like, that's what I'm looking at is that, not necessarily the sticker, but, again, but again, if I'm picking out tortilla chips, that's not a strategic decision for our household, right? So whereas your health insurance spend, this is number two, maybe number three on your P&L. So this is a big expense. And I imagine for an HR director, this is something that touches pretty much everything else they do. I mean, you're in charge of the humans inside this organization, or you're their steward, right? So you're in charge of the recruitment and the retention, right? So benefits is certainly going to play an aspect into that, the overall compensation package. And then people's working conditions and working environment. A lot of times, people leave organizations, first of all, because of their manager or their boss. But second of all, because of the benefits, right? If they've got benefits that they don't perceive as abundant, then they're going to perhaps look elsewhere, right? If all other things being equal, they're perhaps going to start to look around and try and find something that is going to support them better, or maybe there's somebody who either themselves or one of their dependents or somebody that's on their plan, or at least in their household. Has a lot of medical concerns and expenses potentially coming up that, hey, if I change to this different job that's got a better benefit package, at least I'll be able to keep more of my own money, right? Which is, again, part of how we arrived at our value proposition of eliminating employees' out-of-pocket expenses. Care is so expensive, partly, and health insurance is so expensive. And then, a lot of times people feel as though they're being nickeled and dimed along the way if they're in this very fee-for-service kind of model. I know we talked about before when we were did our recording for to set up the subject for today. We talked about Netflix versus Blockbuster, and Blockbuster being that kind of similar to the fee-for-service kind of health insurance model that we're all used to and we've all been operating in for years. Whereas Netflix is now this new model. It's streaming, it's subscription-based, it's at your service, it's at your convenience. And I would venture to guess it's probably less expensive than whatever you were spending at Blockbuster when you start to factor in the late fees that I'm sure you were paying, right? And also you're weaving your way through the aisle to check out your movie, and there's popcorn, there's candy, there's all these other things, right? So if you really look at that, again, you're being kind of nickeled and dimed along the way, and that's something that again is going to, I think, just kind of create subconsciously this kind of scarcity mindset where again, I think that so that's it's a lot to have to juggle all of those things, let alone all the compliance things that we've seen these last few years that are just kind of heaped onto HR's responsibilities, right? With the CAA back in that was passed back in 2021. And a number of other things in more recent years. So,
yeah, I want to pull on a thread, if I could, of what you had shared around, the role of HR within the organization. I think it's got to be a lot, right, to carry that on your shoulders, which could be why there's a fear of making a change, kind of the fear of the unknown. Fear of, if I do this, is there going to be a revolt? Are people going to leave the organization? It's hard enough to attract and retain talent, and if I make this tweak to the plan, is that going to mean that people are knocking on my door and frustrated? But I think you brought something up, Chris, just around, the environment that people are in today, whether you're on a carrier plan or any plan, people just are struggling, right? And this is kind of the ugly, sad side of the world that you and I operate within in benefits, is that benefits are really expensive. They're very confusing. And sometimes you don't know who to call or where to turn. And I think that's where you and I kind of said of like, there's a better way to do this. You almost just have to be not afraid to challenge what's been out there for so long, and to almost take this emotional tie from the big carrier logo and say, okay, that served a purpose, but I'm ready to move on to something that's more transparent, something that I know what my people are going to pay, and something I could save my people money. So I have a question for you, because this has been coming up a little bit more and more in some conversations that I'm having across the country, is carriers are often willing to provide wellness credits or multi-year contracts without raising premiums for 2 or 3 years. There are a lot of smoke and mirror, I think, that's played in our industry. Mm-hmm. I'm curious what your thoughts are, because I'm just coming up against it, and it's like, yeah, sure. Could we figure out how to do some sort of credit for you? Yes. But to your point, like, this is just apples and oranges, and we pay less for claims at Imagine 360. That's what we do. So either you believe we do it or you don't. And then, here's behind door number 1, we're going to give you $200,000 if you come over here. Like, I'm just curious what you're seeing, or what your thoughts would be around that.
Yeah, well, it's very enticing, right? To, if somebody's saying, "Hey, look, we'll give you essentially this rebate or this discount," right? And not necessarily saying that. I mean, that's a whole nother thing, especially rebates on the RX side. But if and I've seen this also, not, premium holidays, right? We'll give you a premium holiday for a month, essentially, if you. All of those, if they're offering that, or my favorite one is the no bid renewal, right? It's like, if you don't go out to bid, this will be your renewal. If you do go out to bid, it's going to be this. I can tell you, if they're giving you a no bid, if they're offering you a premium holiday, or any of these other things, all these other incentives, they minted money on you. They minted money on you last year, and they're not being transparent with what's taking place inside your plan, right? That's just the case, right? And it's all my stance is always too. It's like, look, if they're giving you a 5% renewal increase, most employers would just say, "Oh yeah, where's the dotted line? Let me sign." If they're giving you a 5% renewal increase, you ought to have a flat renewal, right? If they're giving you a flat renewal, you ought to have a 5 or 10% reduction, because again, they're minting money on you. And if they're not, they're trying to just simply buy the business. So this is the other thing I've seen. This happened recently, where a couple of years ago, we went to bid for a group. We came with what at the time was our one of our best solutions. It was still about 18% higher than what they were getting offered somewhere else. Well, so they said, well, look, it's, it comes down to dollars and cents. It's the numbers. Like, we're going to go ahead and go over here because, just because the numbers make more sense. And it's like, okay. And I told them at the time, 2 years ago, here's what's going to happen. If I'm just I don't have a crystal ball, but let's pretend I do. Here's what I'm going to predict is going to happen, is that you get this nice rate. Maybe next year it's a 10% increase, or maybe 15 or something like that. And it's like, oh, okay, well, the next year after that, it's going to be over 30%. It's going to be more than 30% is going to be the increase. And guess what the increase was going into their third year?
Oh, I I'm going to say 45.
Oh, you'd still be wrong. 52%.
Oh,
52% increase. So then they come back to me and say, "Hey, look, you were right." And I'm never going to be the one that's going to be like, "Oh, I told you so," but I guess I just did. So anyways, but they're a client now. So anyways, it's just to me it's like I would rather just be transparent about the way that we operate, the way that the way that Imagine 360 operates. It's like, look, we just don't play those games. Like we're going to find the savings all on the front end, and we're just going to be consistent along the way. And that's the way I'd like to do business. I think it's, there's a lot less friction between us and the clients when we do it that way. We're setting a reasonable expectation. We're not coming in promising the world and delivering that for, again, a short period of time. But it just goes back to the earlier comments about making decisions that are based on this renewal that you're going through right now, rather than looking at, because, you're not going to do that with any other, area of your business. There was a cabinet company that we work with was telling me how they, down to a fraction of a penny, they're negotiating the price of screws and other hardware components that they're building into that. So, it's one of these things that, and they're doing that on multi-year contracts, right, with their suppliers and things, and you can do that with your healthcare plan. People don't necessarily realize that because they just think, well, I've got this renewal, and then next year I'll have a new renewal. Well, yeah, but if you can lock in the price of bundled surgeries for the next 3 to 5 years, then you don't have to worry about what a knee replacement is today versus a few years from now, and where where those costs are going to go in the future. So there's absolutely ways that you can do that. You've just never thought that that was possible because you've been led to believe that wasn't the case. So anyways, and then the other thing that you touched on was wellness incentives. So there again, talk about promising the world. It's like, all right, well, if we'll do a step count competition, and we'll do this and we'll do that, and narrow the network and all these things to kind of try and find ways to shave a point or two here and there off of the renewal, or off of future renewals. What I tend to find is that any kind of wellness program that you have, you're going to have a third of people that are going to do it no matter what. You'll have a third of people that will not do it no matter what. And then you'll have the other third that you might be able to get a few of them to come aboard as well. But I tend to find that those largely fall flat. You don't get the participation you desire. And frankly, sometimes I find they're kind of a distraction from the work, right? Like, rather than doing a step count competition, again, let's find a bundled surgery solution. Let's find a right fit medical management vendor. Let's find a fiduciary pass-through PBM. Those are things that are going to have a far easier impact on your spend and on your employee satisfaction with using the program than any kind of wellness program that's out there. And I haven't really seen anything from I won't name any names of any vendors, but there's certain like wellness vendors that would always kind of tout like the ROI that they were able to produce, and they'd come in and poke and prod people and test them for all kinds of things. And the problem with that is that that actually becomes more of a drain on your claims at times, because you get false positives, you get people that are being over tested, and then it leads to over prescribing and over treatment, and it kind of just flies in the face of what you're trying to do, this early prevention and things like that. And yes, you might get some of that here and there, but again, if you don't have any kind of steerage, and now you've got somebody that has a cancer diagnosis or something that's potentially hundreds of thousands of dollars in claims, a better thing to do would be, in my opinion, to have a medical management vendor in place that's going to help steer them to the best oncologist for treating their cancer, right? So, and we've seen examples of that where we've had people that they go to a doctor that has good bedside manner and all these things, but then as medical management starts to unpack things, they realize, oh, wait, this person has open malpractice suits against them right now. They've got a high readmission rate. They've got a high infection rate. They've got, a mortality rate that's above average for if it's a surgeon, let's say, for example. And we can help people avoid going to those doctors and facilities that are, that are not necessarily going to have their best interests at heart. And that's the other thing. And I'm kind of on my soapbox now, Erin. But the other thing is you have to realize is that even these nonprofit hospitals, at the end of the day, they're still businesses, right? They still operate the same way that you do, where they're trying to increase the amount of services that are getting used. They're trying to cross-sell. You don't think about it that way when you think about hospitals and doctors' offices and things, but they don't operate any differently than the rest of us based on incentives. And so, number of things that I think are wrong with the wellness programs, that certainly the ones that promote themselves as being able to produce an ROI. As far as I've seen, I have never seen an ROI on any of those types of things. And again, just the premium holidays and the buying business, or incentivizing you to stay with them. And sometimes too, the other thing, just continue on this same thread for a minute, is the brokerages that you're working with. A lot of times they have overrides, they've got retention bonuses and things like that maybe they're not disclosing to you. Hopefully they are these days with some of the compensation disclosures that are required. But I've seen plenty of instances where it's like, this makes absolutely no sense why this group renewed with this carrier when they had other options and other opportunities, and yet they had to shoulder that burden. Their employees had to shoulder that burden, and meanwhile, the brokerages and the brokers were receiving more compensation from an increase in premium and from those bonuses and overrides on the larger book of business that they have in place with them. So a lot of misaligned incentives within the financing and the purchase of healthcare, and what we seek to do here at GBS, and I know with the alignment with Imagine 360 seeks to do as well, is to align those ultimately with the employer, and put the employee and their well-being back at the center of this discussion and of this conversation, rather than, oh, gee, we got another 12% this year. What are we going to do? And have a small room of people determining what's going to affect, dozens and hundreds and potentially thousands of people in their organization.
Well, that's really helpful, Chris. Like your thoughts on the background on, all of these misaligned incentives, because I think people can understand when change is made if you explain it. These misaligned incentives are meant to keep you in the corral, right? Don't leave. How many times have you and I heard, I've been with XYZ carrier for 30 years? Well, gosh, have you also had the same hairstyle for 30 years, been driving the same car? None of that sounds good. Like, we got to evolve and grow and know what else is out there. And I often am in this position where I'm meeting with employers, and at times they'll say, my people won't understand this model. And I think we lose and maybe don't always give credit to our employees that they'll understand change if you explain why. And if you talk about, the last 5 years, we have maybe had to increase costs to you employees, increase your premiums. We've increased deductibles. We don't want to do that anymore. And for that, we need you to engage just a little bit. And here's what's in it for you. And I think that's really powerful, because everything changes within each of our lives daily and our work lives. But for whatever reason, my opinion, health insurance has been put in this kind of little fragile box that we can't touch at some organizations. And if we really thought about it, and what Imagine 360 is doing is providing a solution that, for the most part, allows you to keep doing what you're doing today, but pay less.
Yeah.
And not everyone wants to do that, But if the pain is great enough, and if we all took a little bit of introspection to recognize that if you are, let's say you're a manufacturing company and you've got folks making $45,000 on a high deductible health plan of $8,000 for their family, they're struggling today.
Oh yeah.
Right? I
Yeah.
mean, that's what we're hearing more and more of is I've got health insurance, but it feels like my people are functionally uninsured because they can't afford it.
Right. Yep.
Right?
Exactly. Yeah. And in that example, if somebody's making $45,000 a year and their deductible is 8 grand, or their out-of-pocket maximum is 8 grand, that's almost 20% of their annual earnings, right? So that's a huge, yeah. So you're right, that they can't afford to use it, and that kind of again goes back to if we can find a way to eliminate those employees' out-of-pocket expenses, that's the plan. That's a winning plan design. And the other thing too, at least the way that I structure plans here, is we try to mirror the plan that's in place already, and then we offer this enhancement where if they engage with our medical management team, our medical advocacy, our nurse concierge, goes by a number of different names, but or descriptions. But if they do that, then we can eliminate those out-of-pocket expenses, right? We're going to reward them. We're going to provide the incentive for the employee now to say, hey, I've got this issue. I'm not sure how to deal with it. The healthcare system is so opaque and fragmented and confusing, and I don't even know where to begin. Then it becomes a little bit easier for them to say, all right, now I've got somebody who's on my side of the table who is going to help me navigate all this, help me research doctors and facilities and potentially getting second opinions and all of these things. And when I do that, I'm rewarded by not having to pay my deductible, not having to pay my copays or co-insurance. Like, why wouldn't everybody do this? And I had one of our clients' employees at one point. We were on the phone because, frankly, he got on the phone with me, and I'm thinking, okay, this guy's going to have some issues. He's going to have some why is this getting escalated to me? Right? There's a number of layers in between here. This must be really serious. And he basically just didn't believe it. He's like, I just wanted to hear it from you because I don't really believe this. And I explained all this, everything we're talking about here. And suddenly it was just like the other end of the line. It was completely silent. And he was like, I'll never forget this. He said, well, this is how healthcare should have been done since the beginning of healthcare. Like, he just was awestruck at that this was even something that could potentially exist, and anyway, so that obviously it was a very kind of positive, interaction in the end. It just, again, and I think, when you talk about, improving benefits while reducing costs simultaneously, it's like, all right, well, that's the opposite of what I've heard forever. So I just don't believe it. And so, that's sometimes the biggest challenge I run into. And I'm sure, Erin, same for you, is that it's just one of these things where it's like, all right, well, the devil I know is familiar to me. The devil I don't, I'm going to avoid that because I just don't believe it. I just, there's something there. There's some kind of hidden gotcha. And it's, there's really no other kind of transaction that we have anywhere in the economy where it's totally opaque what you're paying for on the front end before you receive it, right? Like, could you imagine showing up at a car lot and they're like, if you want to test drive this or you want to drive this car off the lot, sign here and then we'll bill you later. And by the way, 98% of the bills are going to be wrong. We're gonna, and so you'll have to fight with us to figure out what exactly you actually do owe. And yeah, it's just so foreign that that's how we make decisions. Or the other one too is like, well, we need to make sure that whatever we do, that the plan has a big wide open network, and that they've got all of our doctors in network and all of these kinds of things. And again, that's just that's the 20th century way of thinking about building a health plan. Come into the 21st century where networks are no longer a thing, by and large. We just simply, don't do a lot of network plans anymore. There's not a reason to in this day and age with the different, the different reimbursement models that are out there, the direct contracts, the bundles, all those kinds of things. And it's maybe sounds daunting, but if you're working with the right advisor and you're working with the right solution providers, you don't need to worry about that. We've done this time and time again. We've proven this concept over years, and we've got a number of case studies that we can point to and things like that help demonstrate that. So,
Think,
oh, go ahead. You had a thought.
I was going to say, I think that that's really important what you just said, because if you don't have the right broker consultant that really understands this, you're not going to put it in. And if
Yeah.
you also don't have a thoughtful approach to it, you're probably not going to put it in either. So there are conferences that we go to, you go to, where you show up time and time again. And part of that is to illustrate that this is a relationship business.
Mm-hmm.
And ultimately, a group is going to say yes to moving forward to this transparent model if they believe it. And like you said, Chris, having the case studies, the proof points. I'm on this plan and have been on this plan for 6.5 years, but it's going to be much more powerful if a CHRO or CFO share the story of why they chose the plan than my experience on the plan, right? So just something to add to building that trust and that mindset, I think, of abundance, that it does take time. And I think people should give themselves some grace, but also not be afraid of it.
Right. Yeah. Yeah, exactly. Well, and I think sometimes the fear is, and I've seen this, and I've had HR people tell me this, for example, too, is that a lot of times in many organizations, not all, but in many organizations, they aren't necessarily seen as part of the C-suite, right? They're trying to have a seat at that table. They're trying to advance their career and their value to the organization or the organizations they work with and those kinds of things. And so they see any potential change as a threat to that. And then, so they're afraid that they're kind of really in this catch-22 in many cases. So it's easy, I think, to develop a scarcity mindset when you don't see yourself as part of leadership. Leadership sees you as a cost rather than something that is, adding to the bottom line. And then the employees see, that they don't have access maybe to the C-suite in the same way. So everything basically rolls into HR. So you get kind of complaints from both sides, and that's perceived as a threat to your career. And so a lot of times when I try to help shift somebody's mindset along this, it's like, hey, look, let's set aside what your fears are, right? Let's look at what potential possibilities could be if you do this, right? So if you do this, and we've got some of these examples internally of people that get their out-of-pocket expenses eliminated, or they get routed to a higher quality provider, and then suddenly they don't have to pay anything out of pocket. So I'll share one example that happened. This was several years ago now, where there was a guy, actually, he was making $20 an hour. He's making 40 grand a year working in a warehouse. And he was diagnosed with hepatitis C, which will shut down your liver. It will kill you. It's lethal. There's a drug on the market called Harvoni that will cure you. It's a specialty medication, so it costs upwards of $120,000 a year, or $120,000 for the treatment. Now, again, it will wipe you out, so this isn't like an ongoing treatment that you need to continue with, as some other specialty medications are. But in this case, this guy has Hep C. He's prescribed Harvoni. And immediately he's, within the first month, he was going to hit his out-of-pocket maximum for, with this medication. We had a solution in place at that time where what we were able to do is we were able to source that medication for $27,000, which included his travel. So in this case, We sent him down to the Cayman Islands. He was able to get the medication he needed. So again, we sent him down there. We put him up in a hotel. We sent he had you can take a companion. So he took his wife or his girlfriend with him or whoever it was. They're down in the Cayman Islands for about a week because you can only get this medication. It has to be, it was something like 72 hours apart or something like that. Anyways, so he gets the med. They spend a few days in the Caymans. He gets the other med. So now he's got this life-saving medication, had this vacation to the Cayman Islands. He comes back home. He had no out-of-pocket expense because, again, the delta between 27,000 and 120,000, whatever it was roughly, that amount of money was able to stay in the plan. The plan didn't have to pay for that. So the employer saw this as a huge win. It saved them a ton of money on this one med. The employee then saw this as a huge win because he got this life-saving medication and a vacation, and we gave him some per diem too. But anyways, this was everybody won in that scenario, and so that's what's possible. And the other thing too is that again, making changes to the health plan, it's like, look, there's 5 to 10% of your members that are spending 80% of your claims dollars. So the health plan is already kind of a disproportionate benefit. So why wouldn't we have this, be something that works for absolutely everybody, whatever their need is? And yeah, there are going to be some concerns, but it's also kind of one of these things that, your success in life is going to be determined by your willingness to have, at times, uncomfortable conversations. So if you have this uncomfortable conversation where it's like, hey, look, you've got this life-threatening condition. We've got a way that we can source this drug, but it's going to involve we need your help in this, right? We're going to need to put you on a plane, send you, in that case, it's an easy sell. In other cases, we've sent people down to San Diego. They go across the border to Tijuana. They get the meds they need, and then they come back. And these pharmacies are all first world, tier, they're top pharmacies. This is not some sketchy, type of thing or whatever. It's just, again, goes back to, we pay so much more for drugs in this country and care in general that, medical tourism and is a real, that can be a real, positive thing. So, yes, it sounds different than what you've done. It is, but guess what? It's ultimately the result is better than anything you've ever seen, and anything your employees have ever dreamed of, to the point that, there's these two stories I just shared. So,
and it's like, I think it's about the greater good, right, Chris? Like, I mean, that
Indeed.
sounds like a story of doing the right thing for everyone. I mean, we're all guilty of this, right? If you're in a room, you're thinking about, how is this going to impact me? How is this decision going to impact me? Whether it's my family and my family's medicine, the workload. And a lot of times the folks that you and I connect with have different sets of needs and challenges than the people that are working in the manufacturing firm on the floor.
Yep.
And I love that story because it's an example of, was it more work for you, Chris? Probably, to put that plan in place. Was it more work for the member to get involved in the plan? Yeah, a little bit. But was it the right thing to do? Yes. And usually the right thing to do isn't always the easy thing to do. And
yes.
I'm so excited that I think you said Stephanie Kosh is speaking with you soon. She's a great example of an HR professional that took health insurance, the topic of health insurance, and used it to create just an interesting career trajectory, to be able to say, this is what I did and how I used health insurance as a tool to help my organization. And I mean, it helped her in her career, right? Like, she is all over LinkedIn. She is doing dynamic things, and she'll tell you it's not always easy, but it's worth it. And I think that's ultimately where this conversation is about today, is doing the easy thing it's not always the right thing.
Right. Well, it's, you've painted yourself into a corner by doing the easy thing. You've kind of dug your own grave, dare I say, by doing the same thing over and over. And if you find yourself in a hole, first of all, stop digging, right? Like let's stop doing that. But yeah, so I was going to plug that too. Stephanie is going to be my guest next month. So actually, I'm going to be talking with her tomorrow. And then everybody's going to see the marketing efforts, and we're going to be speaking, I think, on the 24th of May. Anyways, we'll neither here nor there at the moment. But yeah, Stephanie's a great example because she'll tell you, she was in the HR seat and was very used to just using the buka and just kind of going that same route. And she was very resistant to this for a long time. And it took her, and she'll admit this too, that it took her a couple, a year or two to really kind of wrap her head around what exactly this meant, how this could be better, what the potential possibilities were. And she really is. I can't think of anybody that is acting as an HR director that's more of an advocate for this way of thinking than Stephanie is. And she has. I mean, obviously it's helped her own career in the organization that she's at now, but I've met her a few years ago at one of these conferences, and she gets asked to come speak at these conferences and to talk on this subject. And she's now really a thought leader, and it's been, kind of remarkable to see how quickly that she's been able to do that. But yeah, so I'm really excited about, kind of along the lines of continuing this same conversation that you and I are having, Erin. We're going to be doing this same thing next month directly with somebody that is working in that HR role and has seen her career advance because she dare I say took on this risk. But really, I think it's more about she educated herself and she's then the one now that's like pushing the envelope more, saying like, hey, what else can we do now, right? Like we've put some of these things in place. What else is out there that we can also fold in now? What other cost containment? What other enhancement? What other tools can we arm our employees with that are going to enhance this process, that are going to enhance this experience, and that ultimately are going to make sure that these employees are satisfied with their compensation package, with their benefits program, and ultimately get them back to work, to just lead healthier, productive lives, and financially healthier lives as well, because now they're not, again, being nickeled and dimed. They're not avoiding care because they're afraid of financial costs. They're not splitting pills because they want to stretch a 30-day supply out to 60 days and, take half the dosage and just kind of, just tough it out type of thing, right? We shouldn't be confronted with that in the United States, right? Like that should not be a thing. So anyway, so I really appreciate the plug. We know we've got about 5 minutes left, but yeah, looking forward to having Stephanie on next month and just continuing along this same conversation directly from the HR's point of view. In the last 5 minutes here, Erin, any final kind of examples, case studies, or, we've covered a lot just in terms of shifting mindset, but anything else you feel like needs to be added to the conversation?
Yeah, I think, and we hit on this early on, Chris. I think success comes down to execution and planning. Do you have a plan? Do you have goals for your organization? Yes, we're talking about healthcare today and health insurance, and it is looked at a lot of times as an expense. It can be looked at as a tool, and it can be looked at as a resource to help attract and retain talent, but also fill a budget hole. So I will tell a story. So I have a client that came on with us in January. They were fully insured. They have about 400 employees, and they're in the chemical manufacturing space. Prior to joining us, the organization was really struggling. They went through 2 rounds of layoffs, and they removed their employee 401k contribution. Like dire straits over there. If you're working there, it'll be a tough environment to be in. And they implemented our solution in January, and the head of HR was just elated to stand in front of the room and say, I'm not going to ask you to take more money out of your pockets. I've been doing that for the last 5 years by increasing your deductibles and your premiums. What we're going to do is lower your premiums by 10%. And for that, need you to engage a little bit. And that's what I think we're talking about today, is just a shift. It's just a little shift of what could you do differently if you had more support for your people, if you had 15 to 30% back in your budget, and if you planned thoughtfully throughout the year for your benefits plan. So that would be my kind of closing story, is that I think change is possible. It has to start early, and you have to have the right partners and trust, right? Like, this all comes down to relationships. And that's what I love about you, Chris, is anyone that's out there on the LinkedIn Live now, you could call either of us and we may or may not be the right solution and fit for you. And we're going to tell you that.
Yep.
And
indeed.
That's why we do what we do.
Yeah. If I had a mic, I would drop it right there. That was perfect, Erin. I can't add anything to that. That was great. Well, listen, Erin, I really appreciate you coming on today. This has been great. Really enjoyed this conversation, and really eager to see where things go next. So, anyways, appreciate you. I appreciate the audience for tuning in today, and be on the lookout next month. Stephanie Koch will be here, so you will not want to miss that. Particularly if you're an HR director, you will not want to miss that one. So. Don't just take it from me, take it from Erin too.
That's right. She's amazing.
Bye, everybody.
Thanks, Chris. Thanks, everybody.